Shailen Patel, who is present amongst us today. This company has been growing leaps and bounds, and it has quite a substantial market share in the healthcare domain in US. It has sold close to 10,000 licenses, which is being used by the physicians based out of the United States. Dr. Kiran Patel, he is a name to reckon with in the United States healthcare domain. In the year 1999, Dr. Kiran Patel basically took over a struggling HMO and built it to a revenue of $1 billion before he sold it. And he was serving close to 400,000 members in that HMO. He also runs Patel Foundation, wherein he does a lot of philanthropic activities around the world. Mr. Shailen Patel, who's Dr. K's son, he has been involved in the healthcare in the industry for quite a while. He has brought his hybrid background in healthcare and business to bear in many phases of the healthcare industry. In the past, he has worked directly with small physician practices and medical billing services. He has also worked on the payer side of the healthcare. Without taking much of your time, I would just like to brief you or help you understand what exactly this joint venture is all about. This joint venture is for providing revenue cycle management services. The term revenue cycle management is, in India, the healthcare industry is driven by the patients. For example, you visit a doctor, you pay the money and you go out. But that's not the case in the United States. In the United States, the healthcare industry is driven by insurance companies. It has you have to follow certain procedures before a physician gets paid. The way it works is, a physician visits a doctor. Doctor, after diagnosing and treating the patient, does not collect the money from the patient. He does collect a little amount, which is very diminutive, which is called the copay, but the substantial amount is reimbursed from the insurance company to which the patient is enrolled with. So the whole process of collecting the money from insurance companies on behalf of the US-based physicians and doctors is what we define as revenue cycle management. The different phases involved in it are medical transcription, which I'm sure most of you must be knowing. It's converting medical terminology into notes, and then comes medical coding, converting medical terminology into codes. Then comes medical billing, then comes accounts receivables follow-up analysis, eventually collection. This whole process is called revenue cycle management. Now, on an introductory note about VisionaryRCM Infotech India Private Limited, I'm pleased to say that we have great stalwarts of the industry like Mr. Sri Sundararajan, who's one of the board of directors of the Sriram Group of companies, and we have Mr. Abhay Kumar, who is basically one of the most renowned serial entrepreneur based out of Chennai, and we have Mr. Padam Chalani, Mr. Madan Gundecha, and Mr. Raj Surana. It's all said and done, this company is a startup, but we are looking forward to some great activities going forward, and we have some great plans lined up with Visionary Medical Systems. I would like to call upon Mr. Shailen Patel, President, Visionary Medical Systems, Florida, to talk about this joint venture and to talk about the future plans and the beneficiaries of this joint venture. Thank you so much.